Good afternoon, conference. I'm Claudia Peace, Hampshire and Isle of Wight LDC, and I'm a first-time speaker for a conference motion. As you can see by my long narrative, I've been hoisted by my own petard. I've written what I wanted to talk about, and I'm not supposed to repeat myself, so it's a rookie error, I'm afraid, and apologies. However, the key point is this. It is taking too long to evaluate the prototypes in dental contract reform. The delay is making the process feel like it's stalling and losing momentum. And most importantly, it's creating uncertainty for practitioners. The Department of Health and Social Care tell us that contract reform will only be rolled out if it is acceptable to all three major stakeholders. So that's the patients, it's the commissioners, and it's the profession. Those of us who are already prototyping know that it's great for patients. Every time I see a new one, they tell me it's the best checkup they've had. It's pretty good for commissioners too, because as yet it hasn't cost them very much. But where do we fit in? From a jobbing dentist's perspective, I can wholeheartedly support delivering better oral health, the cornerstone of dental contract reform. It's gold standard practice. But what worries me are the financial aspects to our businesses. The decisions about whether to employ an associate or a therapist, the blend allocation, will it be A or B, and the unpredictability of what the future holds. In conclusion, therefore, it's vital that the Department of Health and Social Care finishes the prototype evaluation sooner rather than later. They need to listen to the feedback from the profession, and only then can we know where our future lies. Thank you.
Very much. Right, there are no speakers to this motion, so we go straight to the vote. This will be the last motion for the day, I think. So, motion 17, England only, English LDCs only. Those in favour, please. And those against? Thank you. Any abstentions? The motion is carried. Thank you.
Good morning, conference. Good morning, Chair. I thought you were joking when you said 8:30, but obviously you weren't. I'll try not to blow too much hot air as well. So we are told that work and discussions are ongoing as regards contract reform, and that we're expecting some kind of rollout, be it April 2020 or beyond. However, at the same time, we are working on flexible commissioning, which is great, and there's some initiatives that have been discussed, and to be able to use some of that contract value to carry out things like treatment of the elderly and the young, such as Starting Well Core. The contract reform programme has been going since 2011, and there are gaps, especially in the treatment of the elderly, that is evident that as a profession we haven't tackled. And we feel that the provision of the care should be inbuilt within the contract, and we should be carrying this out. Leaving it out as a flexible commissioning on the side when the new contract comes in will mean individual areas will have to do their own thing. And I'm sure if I ask for a show of hands of how many people are taking these initiatives, it isn't going to be the majority of the room. So I have some experience in this in terms of, in order to get something through, you'll need a paper initially that's going to be picked out by people. Then you're going to need a dedicated business case, and someone will probably then shout out you need a needs assessment. What we feel, especially with the lack of staff in some areas, and I'm sure we're not the only area to administer these kind of things, that treatment of domiciliary care, Starting Well Core and the young, should be actually embedded within the contract, and therefore when contract reform comes in, it is there. And in pre-2006, some people did it, some people didn't, but there was the option to carry out domiciliary care according to that contract. Now, it may be GDPC say, well, we've got that in hand. I haven't heard anything to that effect. So, conference, please back this motion in terms of making sure that the contract reform reflects the whole population with care of the elderly and the young embedded in the reform.
Thank you very much, Jason. Do we have any speakers to this motion? We do, thank you. Just to remind people, if you are speaking to the motion for or against, can you just fill in these little blue chits and bring them to Leah at the desk, please? Thank you.
Thank you, Jason. I think I support the motion with a caveat.
Can you introduce yourself, sir, please?
Yes, Simon Hernshaw, Hull. I support the motion with a caveat. I think both contract reform and flexible commissioning programmes must reflect the needs of the whole population. And contract reform, let's face it, has been ongoing now for a very, very long 11 years. There's been a change in emphasis from care to access with an associated corruption of the financial model. It's stalling, or has it actually deceased? So we need to drive flexible commissioning opportunities because they can be translated very easily into contract reform. So my point is we absolutely need both. We don't need either. So I support the motion. Thank you.
Thank you. Right. Bill Sidhu, are you speaking to this motion, sir? Your chit has gone down the back. I can't collect it. Are you speaking to this motion?
Speaking for the motion.
You are speaking for the motion. Thank you. This is Bill Sidhu, Coventry.
Since this contract we had in 2006, we've been having problems with domiciliary care, providing domiciliary care, and I feel that it should be within the contracts of our GDS contracts, because there are a number of our patients who are getting elderly, who are bedridden, and yet they're expected to be referred to the specialist service like community dental health, and they would prefer to be seen by the practitioner they've seen for years, and therefore there should be a remuneration for this within the GDS contract to provide domiciliary care from the practices rather than just from specialist care. So I would support this motion. Thank you very much.
Thank you, Bill. Next, we have Eddie Crouch, Birmingham LDC, speaking against this motion.
Morning, everyone. Sorry about the voice. Was a late night. In principle, obviously, this is a very admirable sort of objective. The real problem with this is that it's poor commissioning decisions made by NHS England in the past. I remember the conversion that they did for domiciliary care in 2006, and it changed the whole thing from a fee per visit to the course of treatment, and hence domiciliary care diminished on the vine. So the problem with this motion is that it doesn't put extra resources into the practice. And in contract reform, my worry is that if we accept this as a policy, we'll be expected to do domiciliary care along with all the other things that we've been expected to do since 2006. And it's just yet another way that NHS England will squeeze the last elements out of every single contract by expecting us to go out and do all sorts of care without any additional funding. So I ask you to reject the motion.
Thank you, Eddie. We have Jonathan Minor-Wallace speaking against this motion.
I'm speaking against the motion too because I've had to do some domiciliary care in Dorset, and the commissioners expect me to have a full medical kit, oxygen, and a defibrillator to take around to every home. So what Eddie was saying is absolutely right. If we say yes to this, we are opening ourselves to a lot more expense.
Thank you very much. Are there any other speakers? Do you want to come back to this, Jason? You have a minute, thank you.
I think there was advice issued by CQC about mythbusters about what you have to take to nursing and care home quite recently. The issue is if you leave it as it is in the outside, it just won't happen. It hasn't happened for a while. Granted, the point that Eddie's trying to make, that's the practicalities. The principle is the same. As a profession, we want to provide this. We want to provide this as the core of what we do.
Thank you. Right, we shall take a vote. This is an English motion only, so English LDCs only, please. Those in favour of motion 18, please. Thank you. Those against? Thank you. Any abstentions? Sorry, Jason, that's defeated. Thank you. Right, next motion 19, Wakefield LDC, Zoe Connolly.
Good morning. Effective prevention of decay in children has to start very early. Operative treatment on a 3-year-old is challenging for us and also can be traumatic for the child and their parents. In 2006, Scotland led the way with the Child Smile programme, which has been delivered in all health board areas of Scotland since 2011. In 2008, the Welsh Government also piloted Design to Smile, which was a big success and rolled out across the whole of Wales by 2009. Wales and Scotland have both seen big improvements in children's dental health because of the programmes. England has been a little slower off the mark. Starting Well launched in 2016 and identified 13 areas of high need for improvement in children's dental health. Wakefield was one of these Starting Well areas, and practices have enthusiastically taken part in helping their communities understand how to prevent dental disease. But it's not enough just to target a few areas. Starting Well Core is now beginning to be introduced nationally and is being championed by the Chief Dental Officer. Dental decay in the very young often leads, as we know, to extractions under general anaesthetic in a child who may be put off the dentist for years. Unfortunately, tooth decay remains the leading cause of hospital admissions amongst children across the UK, and this is completely unacceptable. English children deserve a national preventative approach. In Wales, the funding allocated for Design to Smile remains ring-fenced and is specifically for delivery of the programme. The Scottish Government has committed to funding Child Smile. NHS England, though, unfortunately, repeats the same tagline: there is no additional money for dentistry. Funding for the Starting Well scheme relies on underperformance resulting in clawback or reallocation of funds from other areas in flexible commissioning. But what will happen if there's no clawback? Should we stop doing prevention, or will NHS England expect practitioners to continue providing this necessary intervention without any recompense? And is this really possible with an already overstretched workforce? We call on NHS England to respond to the obvious need for improvement in children's dental health and change its approach in commissioning these services. Prevention is not something which we should take lightly. It should be embedded in the dental contract and funded appropriately. Please support this motion.
Thank you, Zoe. Anyone speaking to this motion? Okay, thank you. We'll go to the vote. Again, English LDCs only. Those in favour of motion 19, please. Thank you. Those against? Any abstentions? That motion is carried, I think, unanimously. Thank you. Right. Mr. Gidney, you're up. Oh, I beg your pardon, I'm sorry. Okay, sorry. So the next motion, motion 20, Gwent LDC. Please come to, is it Dan? Thank you.
Morning, everyone. Dan Cook, Gwent LDC. So I speak as a member of Welsh GDPC as well as representing the LDC. So there's a little bit of a conflict there, but this isn't a negative thing in any way, shape or form. Contract reform in Wales, we've deviated a little bit from England. It's been largely a positive process, and the discussions, generally speaking, remain quite productive and in good faith. We've had some problems along the way. We haven't supported everything that's happened, but overall, I think most of us feel it's a step in the right direction. In Welsh GDPC, we fully intend and already are scrutinising and looking at this process. What we want in Gwent is we're asking for the backing for Welsh GDPC from peers, as demonstrated at conference, to give that scrutiny and guidance and to give us the backup that we need to do that, so we can provide constructive feedback to Welsh Government and their representatives about the reform process. I must apologise to any of you who don't know how contract reform in Wales is working. Obviously, it's a Wales motion, but I'm more than happy to take any questions about it later on, just informally. So yeah, please vote for this motion, the small number of Welsh delegates we've got. And thanks very much for listening, everyone.
You're done. Right. Our Welsh colleagues only. Those in favour? Against? Carried unanimously. Thank you.